In Nigeria, cardiovascular diseases remain the #1 cause of death worldwide.
African-American women die every year from heart disease.
Individuals are making healthy lifestyle choices.
Every single year, millions of people all over the world die from preventable causes of non-communicable diseases. At the moment, the number of people at risk of dying from these diseases is quite alarming. The World Health Organization reports that non-communicable diseases kill 41 million people each year, equivalent to 71% of all deaths globally. Cardiovascular diseases are the leading cause of non-communicable disease death globally, taking an estimated 17.9 million lives each year.
In headaches, they buy Panadol, but they don't know the cause of the headache.
People don't see them as diseases.
We have more and more people getting hypertension and diabetes. First, we have to know that.
The message here is, take care of your heart because your life depends on it.
We focus mainly on cardiovascular diseases, as this is a leading cause of deaths or non-communicable deaths in Africa and globally.
Of the estimated 17.9 million people that died from cardiovascular diseases in 2019, representing 32% of all global deaths, 85% were due to heart attack and stroke. The World Stroke Organization Global Stroke Fact Sheet 2022 says stroke remains the second leading cause of death and the third leading cause of death and disability combined in the world. This is as expressed by the Disability Adjusted Life Years. According to health experts, cardiovascular disease is responsible for 33% or 1/3 of nearly 500,000 non-communicable disease deaths in Nigeria yearly. Quite a number of Nigerians have taken to exercising and eating balanced diet to rid themselves of the deadly cardiovascular diseases and keep a healthy lifestyle. But there is one very important question. How often do we go for general medical checkups?
Sometimes I go twice in a month.
Normally, I do go every 2 weeks because I know I have the high one.
As far as my own concern, I'm not used to go hospital. I don't go
3 times in a year.
every month. To me, I know they go. I did it last 2 months, and I've not done anyone this month.
Money doctor the man was by the time I shake him. So the man low if okay.
Apparently, there is a growing need to address the issue of physical health care with emphasis on routine checkups and screening tests to reduce the risk of chronic or life-threatening diseases.
Okay, my name is Choma Ozamaka Okafo. I am a public health specialist. I work at H.E.L.P Initiative, Health Empowerment and Livelihood Promotion Initiative, as a program director. What's H.E.L.P Initiative about? I lost my mom to cancer, and I was one of her major carers at the time. God bless her soul. So when I moved back to Nigeria, the intention was to raise awareness on cancer, provide psychosocial support, because if there was one thing I saw in that period, it was the fact that she wasn't entirely open when it came to her loved ones. I think because she was protecting us. So when I came back with that intention to, provide that support and for terminally ill people, I got into a community, a society where even basic health care people didn't know about, and people didn't care about. I will not say didn't care about, but there was not enough awareness about preventive health care, things as basic as blood pressure checks, blood glucose check. People weren't doing it, and this was mainly due to lack of awareness and fear from the unknown. So I said, okay, instead of going for cancer when people didn't even know about basic health care, let me start with that. Let me go into the rural and peri-urban communities and spread awareness about preventive health care, change in lifestyle, at least to mitigate people's risk of ill health. So that's what H.E.L.P Initiative is about. It's about promoting good health and healthy lifestyle in the society.
Evidently, the leading risk factor for cardiovascular diseases is our lifestyle.
Regular medical checkup is very important in the sense that it helps to be conscious of your health. And checking regularly can save a lot of things. When you check regularly, it can reduce the rate of mortality, because when you're health conscious, you know what to guide against.
Some of them feel they don't want to know their health status because of their mental health. They don't want to get affected after knowing the results of the medical checkup. For instance, if the results states that their health status, they have a particular disease, they don't want to know. So you have to encourage them to do the checkup and also let them know the reasons why they are doing that.
There is no particular cause. We only have risk factors which we can guide against. Checking regularly, as in being conscious of your health status, and taking healthy diets, reducing your salt intake, reducing oil. At the same time, much of exercise. With that, it can be controlled.
And for someone that is either hypertensive or diabetic, we encourage them to go to the hospital and see a medical practitioner for further follow-up and for further treatment. And we also encourage them that they should, in as much as they've gone to the hospital to get to see the doctor, they should follow the advice given by the doctor, and they should go to the hospital regularly for follow-up.
If you have noticed some discomfort or pain in your body while carrying out your daily routine at work or in the house, do not ignore, because they could be red flags of an impending cardiovascular disease.
You find out that a lot of them have been having these signs, but because the signs and symptoms of high blood pressure is related to our daily stresses like persistent headache, body pain, so they just attribute it to I'm tired, or because of the stress of work, that is why I'm having headaches. A lot of them go to bed or take the usual and go, and they are fine, and they just continue their daily work. The fact that you are not seeing the symptoms or the signs doesn't mean that it's not causing damage to your body. And most times when you start experiencing these symptoms, the damage or the harm it has caused on the body is already so much that you might, probably some organs might have been damaged already.
Mo discover pé mo feel headache. Orí máa ń fọ́ mi, but mi mọ̀ pé BP mi ló high.
Maybe malaria or any other ailment.
It might interest you to know that contrary to the belief that these diseases only affect a particular gender, body size and age group, it affects both male and female of varying ages and sizes.
Everyone is at risk of cardiovascular disease, but there's always this preconceived notion that it affects only the elderly ones. However, findings have shown that the rates of cardiovascular disease among those aged 30 to 45 years has actually increased. That is why more awareness have to be created about this cardiovascular disease, the signs and symptoms, and the need to always go for routine health check to reduce the morbidity and mortality related to cardiovascular diseases.
Kò bá pé ọmọdé wí àbí àgbà wí, anybody ló lè ní. Mọ́mì, bákan náà méjèèjì yìí lè pààyàn. Tí ṣúgà bá pọ̀ jù, ó lè mú kó dání. Tó bá kéré jù, ó lè mú kó dání. Tí ìfúnpá bá lọ sókè jù náà, bákan náà mà. Ìdí nìyẹn tí a ṣe ń gba èèyàn wa níyànjú.
As reported by the World Health Organization, 75% of cardiovascular diseases deaths occur in low and middle income countries.
Economical issues too is a major part of the reason why they don't come back or turn up for their checkup.
most sinsin kò sẹ́ni tó lówó lọ́wọ́ láti lè ra oògùn. Tá bá lọ sí general hospital sí pé à ń lọ check. Tá bá ní kọ oògùn 10,000 naira fún. Ta ló ní ẹni tẹ́ni kó kọ tó ra oògùn 10,000 naira? Ṣó ti jẹun?
Because you will get there, when they diagnose you, they say you have to pay 300,000 and you don't have 300 kobo. That's another problem.
The effectiveness of the hypertensive care in Nigeria cannot be overemphasized. I must say, the government has tried everything possible to bring it down or to bring it to the doorsteps of the patients. But we are finding it difficult. The sensitization is where the government has not really done more. Patients don't even know what is called hypertension. So for some people are living with hypertension and they don't even know what it is all about. So number one, let me start with this, that creating more awareness will go a long way. And number two, sensitizing patients too will do a lot. For every patient that comes into the hospital has to be given this awareness that, do you know, hypertension is real? Do you know hypertension is a killer disease? So they can help spread the news. Then number three, I think more of advertisement, the radio, the TV will go a long way as well. So I think we all can all put in our best. Everybody in the health sector can put in their best in doing more of sensitization, which will help us to get the good numbers of patients with hypertensive and cardiovascular disease. So with that, we can help limit or reduce cases of sudden deaths.
Creating awareness, making them conscious, it reduces the rate of mortality. When they are aware, they will guide against some things. Like I once have a client that she's even ready to go to the market for that morning. But after speaking with her, she checked her BP and discovering she has a high BP, she has to change her schedule for the day. Now she knows, so it has prevented her from maybe slumping or something of that nature in the market. Assuming she didn't check, she would have just gone to the market that very day and any other thing can happen that very day. So I think it's helping our women to be health conscious and at the same time to guide against any negativity.
In a bid to tackle this problem, Health Empowerment and Livelihood Promotion Initiative has reached over 300,000 women through their various health empowerment programs and public health/health promotion campaigns, teaching them how to be more health conscious.
H.E.L.P Initiative conducts lots of health outreaches. So far, we've conducted maternal and child health. Now, this focuses mainly on educating women on the need for attending antenatal classes. We encourage proper nutrition during pregnancy. We also encourage women to ensure that their children are vaccinated. We also conduct breast and cervical cancer awareness campaign. Here we educate the women on how to conduct self-breast examination monthly and also encourage them to go for pap smear. We also conduct health and lifestyle awareness campaign where we educate individuals on the importance of healthy nutrition, physical activities, smoke cessation, reduction of alcohol intake, and generally adopt healthy lifestyle practices and also go for routine health checks. My name is Evelyn Wachuku. I'm the Program Manager of Health Empowerment and Livelihood Promotion Initiative, also known as H.E.L.P Initiative. Every year, we map out the areas or community we want to reach out to. After that, we go into this community and have a baseline survey. That way, we are able to understand their social demographics. We understand the language each person speaks, the community members speak. We also understand their culture, if there are any cultural barriers that we'll be facing. After this, we design projects tailored to suit each community needs. Then we also engage the community leaders because we understand we can't just walk into a community and give health outreaches. We are going to meet a lot of bottlenecks. So we engage with the union leaders, the community chiefs. We give them the dates, prospective dates that we want to carry out these outreaches. We also create awareness. We have like printouts of flyers, banners, which we place around this community, and these have the date, the health talk we are going to give, and what they should expect. So after this, we now educate our health workers, explaining to them how the community is, the community we are going to, what they should expect, the challenges they should expect, and what they can do to mitigate these challenges. Then during the main events, that is the outreach itself, we go with our team. We can be 8 in number, depending on the number of people we are expected to meet there. At these communities, we now carry out health activities. We start from giving health talks, introduction first. We introduce them on what the project is going to cover, what they should expect, the health talk, health test, counseling, before going in depth on the project itself.
Mo wá láti Kodo. Ní ọjọ́ kan sí ìwà kò wá, èmi ní leader merit. Mo wá kó lọ sí ọ́fíìsì. Mo wá bá àwọn H.E.L.P. Wọ́n ṣe tẹ́sì àwọn èèyàn. Bí ẹ̀mí ṣe ní kí mi náà lọ ṣe tẹ́sì nìyẹn. Mo wá béèrè pé ṣówó ni àbí ọ̀fẹ́. Wọ́n wá ní ọ̀fẹ́ ni káwọn ọmọ mi ló kó wá sí ọ́fíìsì ní center. Mo ṣe àtẹ́sì bí àwọn H.E.L.P. Wọ́n sọ fún mi pé mo ní pé ẹ̀jẹ̀ mi ti lọ sókè.
Check-up tán ṣe fún mi ṣe wọ́n ní pé ìfúnpá mi lọ sí òkè pé ká máa sinmi dáadáa. Then náà sọ pé báwọn ṣe ṣe yìí pé bí àkàtú lọ sí hospital kan lọ ṣe then sugar level tí wọ́n ṣe fún mi wọ́n ní is within bí 80 sí 139.
After the test today, I was made to know that my blood pressure is a little bit on the high side.
The doctor said my VP is high.
Ẹ̀rù ṣàwá bà mí pé kí ló dé, wọ́n ní kí n lọ rí dókítà. Later on, ọjọ́ kejì ẹ̀ mo lọ sí hospital, mo lọ complain.
I can't surprise, but because I'm a single mother, so and I need to feed my children, husband run around.
Which is not a news to me. It has always been up and down due to the business I do.
After the medical checkup, some of those that were checked, they get surprised at the results we get to tell them after the checkup. Some of them feel so surprised that they never knew they had that kind of medical condition, and they are not aware of the condition, so we have to just let them know. And some of them feel a bit down after hearing the results because they feel, why should they have this kind of results? And we have to try to encourage them, and once more we probe further, trying to know what can be the result of this, what can be the cause of this medical results, trying to ask them several questions, the way they live their life, what they do, and from that we'll be able to give the appropriate advice on what they are to do.
They give me drugs, and whenever it finishes, I think I could get the drugs.
One after 2 weeks, baking palawa, you are confirmed. Maybe 2 weeks, mo lọ síbẹ̀, mo ṣá check ẹ̀, I need to calm down.
When they tell me my BP is kind of elevated, then I try to follow the instruction they gave me.
Knowing your risk for cardiovascular diseases is one thing. Following up on your diagnosis is another thing. It is important to know that not following up on your diagnosis is a great risk. However, some of the reasons people do not follow up on their diagnosis are:
you find out that for most of them, this is the first time they're actually going to something close to a hospital. You find out they'll tell you, I've never been to a hospital before in my life. You now ask a woman, but madam, you came here with your child. She said, yes, when I gave birth at home with my midwife. So A lot of them who have raised blood pressure are not even aware. This is the first time they are actually being aware that they had high blood pressure. We try to educate them on the health implications these diseases could have on their health. Now, high blood pressure is a silent killer, because you find out that a lot of them have been having these signs, but because the signs and symptoms of high blood pressure is related to our daily stressors like persistent headache, body pain, so they just attribute it to I'm tired, or because of the stress of work, that is why I'm having headaches. A lot of them go to bed or take the usual agbo, and they are fine, and they just continue their daily work.
According to the World Health Organization, the key to cardiovascular disease reduction lies in the inclusion of cardiovascular disease management interventions in universal health coverage packages. Although in a high number of countries, health system requires significant investment and reorientation to effectively manage cardiovascular diseases. Evidence from 18 countries has shown that hypertension programs can be implemented efficiently and cost-effectively at the primary care level, which will ultimately result in reduced coronary heart disease and stroke. Patients with cardiovascular diseases should have access to appropriate technology and medication.
I would say that the government has tried to establish primary health care centers that are very affordable in most or every local government development area. But the thing is that people are not really aware of these places. And especially in rural places, they'll tell you that the doctors or quality of doctors or nurses are not up par. And so I feel if the government can help us raise more awareness, go into this place and advise these people more, make them aware of these local government hospital, of these healthcare centers in these places, it will go a long way to this. And if we could just push preventive health and health promotion drive, if the government could help us push it more, where we can work with them to go in and talk to people, do doorstep health promotion, person and person one-to-one counseling. I'm sure that will help a lot to, make sure people are aware of certain things that affect their health. But I also feel organizations, we can partner together to reach more people. So instead of, just doing your thing by yourself, doing your thing. So 2-3 organizations can come together and, have a more massive impact, plan outreaches together. If one organization is doing this, another is doing that, another is doing that, then, we can achieve more impact or create more impact when we come together to work together. I would love to reach more people, because sometimes we have a minimum number because of availability of funds and planning. So we have just a very minimum number, and you go out and you see 500 people turn up. We had an outreach in Ikorodu a few months ago. It was for 100 people. We ended up attending to 150 people. And there were a lot of others wishing and wanting to be attended to, but we couldn't even do it. Because what we came with, what we had was just for a particular number. One thing I ensure to do is to do a 20% markup. So that's why we were even able to reach that number. But it broke my heart that I couldn't reach those people. It really did. And I'm trying to plan and see if I could go back there, to create more impact.
To support the Health Empowerment and Livelihood Promotion Initiative, call 080-835-33310.
And I really appreciate Gloomy for bringing this kind of things to the society. creating awareness. Even the ones that are not learned, they now know much about their health. It's a very good program.
With your help, we can touch more lives.
Hi, I'm H.E.L.P Kafo, a program director at H.E.L.P Initiative. With your help, we can make more positive changes, touch more lives, improve people's health, and build a healthier society. Thank you.